Good day, East Hampton and community. Well, welcome back to LTV. Today, we have a very special guest, Dr. Cameron Rokhsar. Dr. Rokhsar is a board-certified dermatologist. He is associate professor at Mount Sinai Hospital. He has received the Top Doctor Best Dermatologist Awards from the Castle Connolly Reports and U.S. News and World Report. He has appeared on NBC, ABC, The Today Show, Good Morning America, The Rachel Ray Show. He has pioneered the non-surgical nose job and non-surgical eye lift. Let's meet this very dynamic and truly remarkable doctor, Dr. Rokhsar. It's a pleasure and an honor to have you here today.
Thanks so much. Thanks for having me.
My pleasure. I'd like to start by asking you about the non-surgical nose job and how you came to pioneer the procedure and what is involved with it.
So Sandy, basically our traditional understanding of changing someone's face, whether it be the nose, the eyes, whatnot, has always been surgery, right? So with surgery, a surgeon goes in and tries to reshape the nose through cutting and snipping and sometimes adding things. The non-surgical way to reshape a nose is a whole new approach. What's the approach? We've discovered in the past 20 years that sometimes by adding things to the nose, we can actually reshape the nose. It's almost like playing Play-Doh with the nose, it's sculpting.
That's
so
great.
We're adding basically fillers to the nose. And the idea basically really came to me in about 2003 when I first started practice. And believe it or not, my first patient was myself. So I always had a little bump on my nose and I wanted to experiment to see how I can make my bump appear smaller. So I started actually injecting myself in the mirror, and that's how I came up with the idea, and I've refined it throughout the years. Now, a lot of people.
Story.
It's a true story.
That's a true story.
Yeah, and of course, in the beginning I was timid about it. Ginger about it. It's the first time I'm doing it to myself, reverse in the mirror. But I've come a long way in the past 17, 18 years in terms of refining the procedure.
Great.
Now, people ask, who is the ideal candidate for a non-surgical nose job? Because everybody, when you want to change your nose, you go to surgery. But we can't do everything that we can do surgically, non-surgically, but there are many things that we can correct non-surgically.
Well, can you correct my nose?
Well,
no, seriously.
I think you have a nice nose. I think you have a nice nose, but
Okay.
For example, a very simple thing that many people complain about is a simple bump on their nose. We can easily correct that. If you have a downward-looking nose, a lot of people are bothered by that. Your nose, the tip of your nose tips downward.
So what do?
You can actually raise the tip non-surgically.
You put a filler?
Yes. So we're actually putting a filler, and there are ways we can put the filler to achieve our goals. Let's say you have a sideways deviation. We can actually correct that sideways deviation non-surgically. Let's say you have a flat bridge, which is a very common complaint in African Americans and Asian noses. They want to create more of a defined bridge. We can achieve that through fillers. So there are many, many things that we can do non-surgically, which really was unfathomable 20 years ago.
And how long does this procedure take?
The procedure is very simple. It takes 5-10 minutes to do, literally. I don't, in the beginning when I started doing it, I used to use numbing cream. I don't even do that anymore because it's that simple. The procedure is virtually painless. All the fillers that we have now have numbing agents in them. They have lidocaine in them. So with just a little bit of ice, I put a little bit of ice on that area, and I inject that area of the nose to achieve the desired cosmetic outcome.
Has your patient load grown in the last? Are you doing this procedure?
Oh yeah, this procedure is tremendous. I mean, there's a lot of patient demand for this. Patient satisfaction is extremely high. Because when you think about it, what is involved in a surgical nose job? A lot of downtime, right? You go in, you have to have a bandage on, you have to have a cast on, you're swollen, you're bruised.
And there are
it's
immediate
painful.
results?
The results, you have to wait 6 months to a year to see your final result from a surgical nose job because a lot of swelling happens. This is the exact opposite. This is immediate satisfaction. This is you walk in, 10 minutes later, you walk out with a new nose. Bam. So, none of that. No downtime. You may get a little bit of swelling for a day or two, but there's no pain afterwards. There's no bandages. There's no swelling. And you go about your daily life. You don't have to take time from your professional or social life, really.
Great. Jody, Riley, why don't we go to the video and see Dr. Rokhsar perform this procedure?
Here we are with these two adorable sisters, and they both have kind of similar noses. And we're gonna do the non-surgical nose job for them. So stay tuned. The nose a little bit right now, just plain old alcohol. There's a bump here, and our tip is down. We're gonna fix both of it now in a matter of seconds. We're gonna raise her tip now a little bit. Her tip is depressed here. So, what do you guys think of your non-surgical nose job?
I love it. We love it. Honestly.
Home run, A+.
A+, 110.
Very nice. That's great. That's truly amazing. Thank you. Thank you very much. And Dr. Rokhsar, let's talk about the non-surgical eye lift, because that, for many people, especially women, I'm sure is very prevalent and desired.
The eyes is a major focal point when we look at someone's face, just like a nose is. It's an area that grabs our attention very easily. And the aging process does a lot of different things to our facial structure, especially around the eyes. The very common thing that happens as we grow older, which a lot of people don't really equate with happening to their face, is osteoporosis. We all know that we get osteoporosis. Our bone structure shrinks as we get older. But most people think about that as a unique phenomenon just to the spine. But that's really not the case. Our skull, which is our major structure of our face, actually undergoes osteoporosis, so it shrinks with time. In addition, gravity and aging causes skin laxity. The skin falls down. In addition, many things in the face also shrink, including the muscles and the soft tissue structures of the face. So again, traditionally, what had been the main, the main thing to fix some of these structures is surgery. With surgery, what do? If you have hooding of the eyes, if you have heavy eyes, you go and you cut that skin. In the lower eyelid, where you have bags, let's say, or loose skin, what do? You go and cut the bags, cut the fat out, or cut that skin out. Again, things that require downtime, bruising, so on and so forth, stitching. Now, again, we've discovered that by adding things, we can improve things. So what do? We add a filler around the eyes. With the filler, we can change many things. For example, we can camouflage the fat pads underneath the eyes. So when people complain about bags underneath the eyes, that's fat pads. You can actually go under the fat pads and you can put filler to camouflage or to create a more congruent look from the cheek skin to the eyelid skin.
And how long does this proceed? How long will this last?
The results typically last 1 to 2 years.
That's great.
Yeah, a long time. And the procedure again takes 5-10 minutes. And another thing that it corrects is, under eye color. A lot of people complaining about the under eyes look tired, they look dark. Well, that tired look has to do with shadowing. I always tell patients it's about a hill and valley effect, right? The hill always looks shiny, it looks bright. The valley looks dark. So by, in surgery, what you're doing is you're cutting the top of the hill. Non-surgically, you're filling the valley. By making things more congruent, you get rid of that shadowing or the darkness.
That's wonderful. Very nice. That's great. I would like to move on to talking about October, as we know, is Breast Cancer Awareness Month. Does skin cancer relate to breast cancer in any way? And what should women and men be aware of?
That's a very interesting question. And the topic of breast cancer, obviously, is something that's very dear to me. I've had family members that have been affected by breast cancer.
Right.
And there's been some evidence in the past 10 years that possibly people who've had breast cancer may be at a higher risk for developing one type of skin cancer called melanoma, which is the deadly skin cancer. Melanoma is the cancer of the moles, of the pigmented lesions on the skin. For example, there's been some studies that have come out recently that have shown that patients who have the gene BRCA2, which is a common marker for developing breast cancer, may also have an increased risk for melanoma, cutaneous melanoma. On the other hand, it's also been shown that there are some genetic markers for melanoma. For example, there's a gene by the name of CDKN2A, and these patients are more prone to developing melanoma. And again, this subset of population is also at a higher risk for developing breast cancer. So I think it's very important for your viewership to know that if you do have a history of breast cancer, you need to be more cognizant of screening for skin cancer, namely melanoma, and potentially vice versa. If you have melanoma, maybe you need to be more cognizant in terms of staying on top of your breast cancer screenings with your yearly mammograms and so on and so forth.
Okay, very good advice. And I was reading that breast cancer cells can spread to the skin.
Correct. I mean, so breast cancer, if left untreated, can certainly metastasize not only to bone and brain, but it can metastasize to the skin. So you can actually get, masses that kind of protrude through the skin in breast cancer.
Wow.
There is also cancer of the areola, something called Paget's disease, the nipple. And so Paget's disease actually often goes underdiagnosed, misdiagnosed as eczema of the nipple. So I always tell patients, if you have long-standing irritation or what doctors may diagnose as eczema in the nipple, you ought to get the help of a seasoned dermatologist and potentially have a biopsy of that area to make sure it is just eczema and not nothing more than that.
Okay, well, thank you for sharing that with us. That's all good advice. Moving on to Fraxel laser surgery, the resurfacing of the skin. And I've read that that is the #1 resurfacing technique.
Yeah, so basically the idea of resurfacing, what is resurfacing? So there are many things in the skin that can be corrected by creating new skin. For example, acne scars, surgical scars, wrinkling, pigmentation of the skin, sunspots. These are all things that happen with age, and a way to address them is by resurfacing. So resurfacing means we're creating new skin. Now, in general, what laser resurfacing is doing is the laser is tricking your body or your skin to create new skin. How does it do it? The laser, namely Fraxel or fractional resurfacing, the laser puts an array of random microscopic dots in your skin. So the laser is actually coagulating, these little random pattern of dots in your skin. And so the body sees these dots as dead skin, and it tries to replace them by new skin. And that's basically the underlying mechanism in terms of creating new skin. Now with fractional resurfacing, something like Fraxel, we're doing this gradually over time. These array of dots are put into the skin. Even though your skin looks red uniformly, the pattern is placed in about 30 to 50% of your skin at one time. And when you repeat it over time, over a course of 3, 4, 5 sessions done monthly, you're actually tricking the body to create new skin. Skin that's firmer, less scarred, less wrinkled, and devoid of sunspots or brown spots.
So you're finding that this procedure is used for people that have a good deal of acne and scarring to help make the skin look better that's been damaged in some way?
So acne scars, certainly, acne, how do people develop acne? What's the reason for acne scars? Intense inflammation from acne eats away at the structure of the skin. We have proteins in our skin, which, a lot of these names are much in vogue these days, like collagen, elastic tissue. These are all proteins in the skin that give structure and rigidity to the skin. Intense inflammation from acne, whether you have cysts or pus bumps or so on and so forth, eats away at the basement membrane protein. It degrades them. That degradation causes the skin to develop a void, and that's why you get depressions in the skin. That's why people with acne scars, they call them pot marks, because they have depressions in the skin, because the collagen has been damaged, the elastic tissue has been damaged. So the laser tricks the body to create new skin around these zones. Same thing with wrinkles. Why do people wrinkle? Well, certainly gravity, we know, is part of it, and aging. As we age, things become looser. But also we know that a major cause of wrinkling is the sun. right? The sun causes degradation of both collagen and elastic tissue over time. And that's why the skin becomes wrinkled and loose. And so again, something like fractional resurfacing aims to replace the old collagen, the old elastic tissue, and restore elasticity and rigidity back to the skin.
Okay, and talking about that, that brings me to ultherapy, correct, which is about the collagen, getting the collagen to be stimulated and to regrow, or?
Yeah, so the idea is skin tightening, right? So
Okay.
again, we touch on this subject of skin tightening. Again, classically, when people thought about skin tightening, they thought about a facelift. So what's a facelift? You actually cut the skin around the ear, you pull it back, you cut, and you resew. It's like redraping, right? So non-surgically, basically the principles that we've discovered over the past 20, 30 years is that we can trick the skin also to tighten non-surgically. What's the principle behind that? The principle is putting heat in the skin.
Okay.
Collagen and elastic tissue, some of these things I just mentioned, these are proteins that are spring-like in nature in terms of the molecular shape of these proteins. And though these proteins can actually change configuration in response to heat, they can actually tighten up.
Okay.
So many of the non-surgical skin tightening procedures we do aim to heat up the skin selectively. You named Ultherapy. Ulthera uses focused ultrasound. Now, classically, we think of ultrasound as being a diagnostic type of procedure. We do ultrasound to, look at things inside. But focused ultrasound, actually, the ultrasound is focused that it heats the skin very selectively at certain depths. Intense heat at depth of 3 millimeter, 4.5 millimeter, and that heat causes tightening of the skin.
And do you recommend this procedure?
Yeah, the procedure is a very nice non-surgical way to tighten the skin.
And does it take over time? The skin gets tighter?
That's correct. So what happens is that you put the heat in, through the form of ultrasound. The skin really does take 3 months to get to where you want it to be. That remodeling, that tightening continues over a course of 3 months. So you do the procedure and you'll see your final results about 3 months down the road.
Now, how does that compare to cool sculpting? And I've read that a lot of people, and something I might even be interested in, where it gets rid of the fat under the chin.
Right. So we're touching on all the cool subjects here. So cool sculpting, we're switching gear to fat, has been around now about 12 years. And cool sculpting, the principle behind cool sculpting is that we can destroy some fat cells through non-surgical freezing of the fat. So with cool sculpting, you get attached to the device with a certain handpiece. For example, you mentioned the neck, the submental area, we call that submental fat. So you can actually get attached to we attach you through a handpiece and you sit for about 30 minutes, 45 minutes, depending on the area that you're treating. And the machine takes the tissue through controlled cycles of cooling. So you want to cool the skin, and that cooling freezes some of the fat cells and causes selective injury to the fat cells.
Okay, and this procedure, how long will it take?
Again, so let's say if you want to treat the neck, it's about a 45-minute procedure. You just sit with the device. Again, it's not painful.
And this also lasts for about a year or two?
The results are really permanent with cool sculpting, right? Now, cool sculpting is not going to get rid of every fat cell that you have in the area. In general, we tell people you get about an average 20% reduction. But whatever reduction that you get is yours, given that you don't gain weight.
Okay.
Obviously, if you gain weight, the body finds a way to create new fat cells and kind of bulk up your existing fat cells.
Okay, and I know that you represent some drug companies, correct? And you do some teaching?
Yeah, so I've been lucky in my career where I've been a trainer for many cosmetic companies. For example, I'm a trainer for Allergan, the creator of Botox. So that I like because I get to teach my colleagues, the residents, basically on some of the best injection techniques and so on and so forth.
Okay, well, we didn't say Botox. Let's talk about Botox. I mean, is that still the number one?
Yeah, how can you talk about cosmetic stuff without talking about Botox? So, Botox has been around for more than 20 years. It's the number one cosmetic procedure in the world year after year after year. And the reason for that is because it works, and it works on everybody, and it's simple to do. Now, some people hear the word Botox and they have reservations about it because they equate that with Botox toxin, because in essence, we are relaxing the muscles by injecting botulinum toxin at very controlled doses. But Botox, not only do we use it for cosmetic reasons, Botox has FDA approval for multiple medical indications as well. Then the list goes on, whether it be migraines, whether it be strabismus, having crossed eyes, whether having torticollis, neck spasms or neck stiffness or muscle stiffness. It's FDA approved for hyperhidrosis or sweating. So the list goes on and on in terms of
sweating,
safety.
Where do you apply?
So for sweating, we can actually inject the areas that you sweat. Mm-hmm. So those areas, people have sweating under their arms, if they have hyperhidrosis, increased
the palms,
sweating.
I guess.
You could do the palms. The palms are people who really can't function properly because they sweat so much where the sweat drips off their hands. They're embarrassed to shake people's hands. They can't hold a pen because the paper gets dripped with their sweat. There are people that sweat so much in their feet that they literally fall because their feet are always slippery. Mm-hmm. So again, I think Botox is a game changer for many of these patients. So that's for hyperhidrosis. And then for cosmetic reasons, really Botox treats wrinkles that are created through use of muscle. And so generally we talk about Botox being used on the upper half of the face where our muscles are so closely juxtaposed to the skin so that those muscles, when they move, they create wrinkles. So we talk about frown lines or the 11 lines, the forehead horizontal lines, and also the lines that you create through smile. That's called crow's feet. Botox is highly effective for treating those three areas.
Okay. Is there any particular procedure that you particularly are like performing and
I love doing fillers in general. We touched on the use of fillers for the nose. We touched on the use of fillers to address issues around the eyes. But in general, the use of fillers has really become a game changer because you can do lots and lots of things with fillers in terms of molding or sculpting someone's face.
You get to be an artist.
Yeah, so it really is. And
yes.
I think it brings science and art together. And I do think that you have to have a good eye to be able to do this thing that we do, because it's not just about science. Obviously, science is very important, but this is where art meets science. So with fillers, there's a lot that we can do these days to really change someone's face for the better. Mm-hmm. For example, we can create cheekbones or cheeks to lift someone's face, something that could only be achieved surgically through a facelift. Obviously filling someone's hollowness around their mouth. Creating a more chiseled jawline can be achieved with fillers. And the list goes on and on. I mean, I have patients, let's say, who wear earrings. The earring hole has become too big. You put a little bit of filler in the earlobe, and the earring sits nicer. So there is so much you can do with fillers, and it's a lot of creativity, and it's really a lot of fun.
No, that's
and
great.
Just to see people's reactions, where you can achieve these amazing, great results,
and they love the way they look afterwards.
And they look at the mirror and they're like, "Wow, I can't believe this! We could do this." And again, these are things that were not fathomable 20 years ago.
Now, where do you practice?
So I have two offices. I practice in Upper East Side, Midtown. I have an office on 60th Street between Lex and Park, and also I have an office in Garden City, Long Island. I also teach at Mount Sinai. I teach the cosmetic clinic to Mount Sinai dermatology residents. I love it. I mean, it's one of the fun things. Look, it's kind of paying it not forward, but I've been trained by other doctors, and I think it's really nice to be able to contribute and train the next generation of doctors the right way.
Correct. Well, we also need you out here. So Southampton might be one of your next.
You can all make the trip to Garden City. It's only an hour drive. It's not that far.
Okay, that's true. Well, great. Well, Dr. Rokhsar, it was a pleasure having you here today and a true honor. You're a remarkable man, a remarkable doctor. I know you were also Harvard educated. and attended New York University School of Medicine. And we're very proud to have you as a doctor and have you helping all of us.
Sandy, thank you so much for having me. I enjoyed the show.
Yes, thank you. And please stay tuned. Up next, we have Rokhsar Fukuda. Rokhsar owns the Rustic Cake Studio, and she works out of the East End Institute in Southampton. And we will be doing a cooking show. We will be baking some amazing Thanksgiving desserts. So stay tuned for that. And in addition, as we all know, it is October Breast Cancer Awareness Month. So please, everyone, pay attention, go for screenings, and think pink. Thank you so much, and until the next time, it was a pleasure being here and seeing everyone. Thank you, LTV.